So I think one of the things that I really appreciated about coming to work at West Central was the opportunity to kind of figure out what was a fit for me in terms of career and in terms of how I could kind of see myself connecting with mental health and community mental health. I started out as a case manager, which is a degree that sort of requires like a bachelor's level education. So a lot of my colleagues can come out from college, and it's an opportunity to be out in the community, kind of learning firsthand with people what their day-to-day needs are, how are they navigating life. And then I had the opportunity to move into a therapy role, and so I've had opportunities to kind of continue to learn and develop skills myself that I could implement in different ways. And I think that that's been one of the really interesting and kind of enjoyable parts of the work that I've done, is to getting to walk alongside of a lot of people, some people who are coming into right out of school and just are trying to figure out, is this a career path that I want to pursue for this phase of my life or as a long-term career. And then also working with people who are just coming out of grad school, really starting to develop their skills and mastery of therapy, because we learn a lot in school. We learn a lot through the higher education process, but really figuring out what works, what doesn't work, what our style is, what are some new kinds of ways that we have to be in the world with clients who are experiencing kind of acute and persistent mental illness and are really struggling and need some immediate support. And so we have to learn really on our feet, and that has been a really crucial part of my role, is just to sort of be able to learn with the clients to sort of figure out what's going to work for you, to sort of pull in skills to ask and tap into. I mean, I think one of the best parts of working in community mental health is that it's a team-based approach for treatment. So we're able to pull from the experience and wisdom from a lot of different people, because the work is really, really hard. And we're put into very stressful situations as clinical staff. And so to be able to lean on others, to get support, to bounce ideas around, to be able to just pull from people who have been through med school, who have been working for 15, 20 years in a variety of different roles, to be able to kind of tap into that wisdom so that we're not trying to do it on our own. Because I think that's what leads to burnout for a lot of folks, is to not have the support of a team. And so to be able to work here and learn with a team, to sort of grow, and then as I've developed skills and experiences, to be able to sort of support others, has been a really important part of my work over the last years.